Hello everyone, Dr.Mungli here. So this video is about Carnitine Shuttle mechanism. Note that Carnitine Shuttle mechanism is needed for transport of long chain fatty acids from cytoplasm into the mitochondrial matrix for oxidation purpose. See, during fasting condition and starvation, when the lipolysis will be going on, so the fatty acids, especially long chain fatty acids, which are carried from adipose tissue to the liver by binding to albumin, so they will get into the cytoplasm, but oxidation of fatty acids will be going on in the mitochondrial matrix. So the long chain fatty acids, they cannot pass through inner mitochondrial membrane, whereas short and medium chain fatty acids, they can pass through inner mitochondrial membrane, so they don't need any Carnitine shuttle mechanism. Whereas for long chain fatty acids, especially for LCFA, that is long chain fatty acid, you need a Carnitine shuttle mechanism to allow the fatty acid into mitochondrial matrix. What is this carnitine now? See, the carnitine molecule, it will be synthesized in the liver. So the liver is going to synthesize carnitine. Predominantly liver is the organ which synthesizes carnitine, and the carnitine synthesis, it needs lysine, amino acid lysine and methionine. Amino acid lysine and methionine, these are the essential amino acids, so they both are required for the synthesis of carnitine in the liver. Now here is the Carnitine shuttle mechanism for you. So in the so I have written here outer mitochondrial membrane. So this is the outer mitochondrial membrane. So we have intermembrane space and we have inner mitochondrial membrane and the matrix of mitochondria. So in Carnitine shuttle mechanism, so before a fatty acid is getting into the mitochondrial matrix or any fatty acid that has to undergo beta oxidation, that has to be activated. So the activation of fatty acid, it will be done by an enzyme called acyl-CoA synthetase. So the fatty acid activation, it will be done by acyl-CoA synthetase enzyme. So as it is shown here, so this is the acyl-CoA synthetase, which is located over outer mitochondrial membrane for long chain fatty acids. So long chain fatty acids in the cytoplasm, so they will be activated by acyl-CoA synthetase located over outer mitochondrial membrane into their respective CoA form. In this process, CoAsh, that is reduced coenzyme A, is used, and also note that ATP is converted into AMP. It means 2 ATP equivalent energy is used to activate long chain fatty acids. Now what about medium and short chain fatty acids? Medium and short chain fatty acids, they directly get into mitochondrial matrix, and we have acyl-CoA synthetases for short and medium chain fatty acids in the mitochondrial matrix itself, and they will get activated there and they will get into beta oxidation. Now long chain fatty acids, once they are converted into long chain fatty acyl-CoAs, so they get into the intermembrane space. Now in the intermembrane space, so these long chain fatty acids, they will be converted into long chain fatty acyl carnitine molecules. So the long chain fatty acyl carnitine molecules, so as LCFAs are converted into LCFA carnitine, and this job is done by outer mitochondrial located enzyme called carnitine acyl transferase 1, which is also called as carnitine palmitoyl transferase 1. So carnitine acyl transferase 1 or carnitine palmitoyl transferase 1, it is located over outer mitochondrial membrane, and that converts LCFA-CoA into LCFA carnitine, and that's where you need carnitine. This is where the carnitine role comes in. The carnitine is synthesized by the liver, and this is participating in transport of fatty acid into the mitochondrial matrix as long chain fatty acyl carnitine. Once you get long chain fatty acyl carnitine, so this long chain fatty acyl carnitine is transported into the mitochondrial matrix, by carnitine acylcarnitine translocase enzyme, which is located in the inner mitochondrial membrane. Once you get LCFA carnitine in the mitochondrial matrix, but what you need for beta oxidation is LCFA CoA. So that is why LCFA carnitine is converted into LCFA CoA and carnitine is released. This job is done by carnitine acyl transferase 2, which is also called as carnitine palmitoyl transferase 2, and that is CPT2, which is located in inner mitochondrial membrane. Now what will happen to the carnitine that is released in the mitochondrial matrix? So it will be carried back into the intermembrane space, and that will be done by carnitine acylcarnitine translocase. Like this, carnitine will move back and forth. Note that carnitine that is released here, so it is going to be carried back into the intermembrane space, and that carnitine is going to combine with LCFA CoA to become LCFA carnitine, and that LCFA carnitine is coming into the mitochondrial matrix as the carnitine is moving out into the intermembrane space. So every time carnitine will shuttle back and forth to bring long chain fatty acyl CoAs into the mitochondrial matrix. That is why this transport is called as Carnitine shuttle mechanism, because carnitine is shuttling back and forth here from matrix of mitochondria into the intermembrane space every time when it brings long chain fatty acids into the mitochondrial matrix for beta oxidation. Now this long chain fatty acid here, it can undergo beta oxidation, and the beta oxidation video I have already posted in YouTube, and it is available. The link for that video, it is now appearing on the upper right corner right now, and also link for that I have given in the description below this particular video. Okay, now let's move on to see some of the applied aspect related with carnitine. So carnitine deficiency. So carnitine is synthesized in a liver by lysine and methionine. So since this is a protein which is synthesized in the liver, so there are enzymes involved in carnitine biosynthesis. So all enzymes are proteins here, so there can be a defect in gene coding for the enzymes that are involved in carnitine biosynthesis, and that can cause congenital carnitine deficiency. So the congenital carnitine deficiency is a mutation in a gene coding for carnitine biosynthesis in the liver. Now there are acquired causes for carnitine deficiency. Acquired causes can be divided into liver failure. So liver failure, liver is not working fine, so it means carnitine is not synthesized properly. Or it can be seen in essential amino acid deficiency. Essential amino acid deficiency, that is deficiency of lysine and methionine, can lead to carnitine deficiency. Or it can be because of hemodialysis. Hemodialysis, in this process there can be a loss of carnitine because of the dialysis process itself. So the end stage renal disorder patients who are undergoing hemodialysis, they can be at risk of carnitine deficiency. Now let's see what all the deficiency manifestations for carnitine. So note that carnitine is needed for beta oxidation of long chain fatty acids. Now whenever there is a deficiency of carnitine, so this beta oxidation cannot go on properly. So because of that, so there can be a energy deficiency manifestations can be seen here. So it means during exercise, skeletal muscles, they need fatty acids for energy purpose. So the long chain fatty acids coming from adipose tissue, so they won't be able to be oxidized in carnitine deficiency, and that can give rise to exercise intolerance. Exercise intolerance is one of the sign that you are going, one of the feature clinical sign that you are going to see in carnitine deficiency, and this can give rise to skeletal myopathy. So this can give rise to rhabdomyolysis. So rhabdomyolysis can give rise to myoglobinuria. It can give rise to cardiomyopathy, and the breakdown of skeletal muscle can increase ammonia level, hypoxanthine, inosine levels, and all this. And also note that during carnitine deficiency, there will be accumulation of long chain fatty acids in blood, in the tissues and blood. Accumulation of long chain fatty acids in tissues and in blood. So some of these long chain fatty acids can get into omega oxidation and they can become dicarboxylic acids. So these are some of the signs that you are going to see in carnitine deficiency. Let's see what all the other signs that you are going to see. So what if there is a deficiency of carnitine acylcarnitine transferase 1, that is CPT1 deficiency. If there is a CPT1 deficiency, it means that leads to elevation of LCFA-CoA, and that is long chain fatty acyl-CoA will be elevated because LCFA is not converted to LCFA-carnitine, and this LCFA-CoA can diffuse into the cytoplasm, and LCFA-CoA can be converted to LCFA long chain fatty acids, and that long chain fatty acids will build up in the tissues and later it can build up in the blood. So elevation of LCFA, that is long chain fatty acids in the tissues and in the blood, and that indicates either carnitine deficiency or carnitine acyltransferase 1 or CPT1 deficiency. So the signs and symptoms are similar to what I have explained in the previous slide. Now let's see what if there is a deficiency of CPT2 enzyme or carnitine acyltransferase 2 enzyme, which is located in the inner mitochondrial membrane. So if there is a deficiency of carnitine acyltransferase 2 or CPT2, it means there will be elevation of LCFA carnitine. This is the difference that you should differentiate here. So the LCFA carnitine is elevated, and this LCFA carnitine will appear in the cytoplasm and accumulate there, and also later it appears in the blood. So blood levels of LCFA carnitine will be elevated if there is a defect in CPT2 enzyme located in inner mitochondrial membrane. So signs and symptoms will be similar to what you have seen in carnitine deficiency, including cardiomyopathy. So the difference here is in carnitine deficiency and carnitine palmitoyl transferase 1 deficiency, you will see elevation of only long chain fatty acids in the tissues and in the blood. Whereas in the deficiency of CPT2, you will see elevation of LCFA carnitine. You need to take a note of that. There is elevation of LCFA carnitine there in the tissues and later in the blood. So these are some of the deficiency manifestations with carnitine, the CPT1 and CPT2. Now let's take a look at one of the molecule which has drawn recent interest, especially with the tennis player Maria Sharapova. So the molecule is Meldonium. So this Meldonium is it's a anti-doping agency has banned this drug. This is a banned drug. So this drug has been banned by anti-doping agency. So because one of the tennis player, that is Maria Sharapova, she was found taking Meldonium. Now let's see what is this Meldonium. So Meldonium basically it decreases or it inhibits synthesis of carnitine. So the carnitine synthesis is inhibited. Carnitine synthesis is inhibited by Meldonium because it's going to inhibit some of the enzymes involved in carnitine biosynthesis in the liver. By inhibiting carnitine biosynthesis, so the overall availability of carnitine, it will be less. It means during exercise, transport of fatty acids into the mitochondrial matrix, it will be reduced. During exercise, the fatty acid oxidation will be going on and ATPs are produced, and that supports the exercise, means the muscle contraction and all that. So here, by inhibiting carnitine synthesis and inhibiting carnitine transport mechanism, so fatty acids are not getting down into the mitochondrial matrix sufficiently. It means oxidation of fatty acid has been slowed down. Note that fatty acid oxidation consumes much more oxygen than oxidation of glucose. This is where is the meldonium comes in sports activity. So whenever intensity of this activity or the muscular activity increases, so the muscle is going to break down fatty acids and make acetyl CoA, and that gets into TCA cycle, and that will NADH and FADH from TCA cycle will get into electron transport chain, and that will consume too much of oxygen. So the oxygen consumption during fatty acid oxidation during exercise is much more than the oxygen consumption by glucose. So by taking meldonium, so you are decreasing fatty acid oxidation. It means you are decreasing oxygen consumption during muscular activity. It means the player's respiratory rate is under control. So you are basically increasing oxidation of glucose rather than oxidation of fatty acids. And also meldonium has been shown to remodulate or the oxygen consumption during exercise. So with all this, the remodulation from functions and also decreasing the carnitine transport shuttle mechanism, so the meldonium, it will make sure that fatty acids are oxidized less. It means consumption of oxygen is less. So glucose means energy needs of tissue, skeletal muscle is coming from oxidation of glucose. It means oxygen consumption is modulated, thereby respiratory rate is under control, thereby player can concentrate on the play rather than on the respiratory rate, and also patient don't feel fatigue, because if your respiratory rate increases, so the fatigueness sets in, so that is controlled by meldonium. That is why this drug has been banned by anti-doping agency. So this is something related with carnitine synthesis or the role of carnitine in fatty acid oxidation. So the meldonium is basically targeting carnitine shuttle mechanism here. So this is all about carnitine shuttle mechanism. Thanks for watching as always, and see you in my next video. Till then, take care.